Hi, I'm Jill Stokeld. I'm here today at the Baton Rouge Clinic, and I'm visiting with an ear, nose, and throat doctor, or ENT, Dr. Hardy. Thank you so much for your time today.
You're welcome.
Okay, with your extensive experience that you have in this field and living in our lovely climate that's humid and has all of the crazy variables, what do you most commonly see as far as sinus issues with your patients?
We see a lot of variation of symptoms with seasonal variations. Obviously, in South Louisiana, we have a lot of quick barometric pressure changes that can wreak havoc on the sinuses, a lot of flora that is unique to this area. So those two things in particular tend to cause a lot of issues and wreak havoc on the sinuses.
Is there anything that can be done to prevent, troubles or issues?
That's a great question because really preventative medicine is the best medicine. So typically what I recommend to my patients is doing regular saline flushes of the nose to keep the nose very washed out, keep any of those allergens from building up, keep the irritation down. Oftentimes steroid nasal sprays, which can be gotten over the counter, are a good adjunct treatment as well, just to keep down the inflammation. And then intranasal antihistamine sprays or oral antihistamines are a good thing as well.
So when would one know okay, it's time for me to call the doctor? This has progressed past, my home over-the-counter options.
So typically, time-wise, if infective symptoms last for over a week to 10 days, then it's probably time to go in and see somebody, maybe get an antibiotic. A lot of times, we will treat with an antibiotic or steroid to try to calm down the inflammation and possibly infection at that point. And a lot of times, if we can catch it fairly early on, that'll do the trick.
Okay. Now, I know you were recognized last year by Baton Rouge Parents Magazine as the family favorite ENT. So talk to me a little bit about what is the difference between pediatric and adult, and maybe some different things that you see there and how you treat those patients.
Absolutely. So one of the big differences between adults and peds is probably the role of the adenoid tissue. And the adenoid tissue is lymphoid tissue that lives in the back of the nose. And in kids, it tends to be enlarged and hold on to bacteria. It actually atrophies over time as we age and becomes less of a problem. But in kids, it can really contribute to poor nasal drainage and recurrent sinus infections. So a lot of times in kids with sinusitis concerns, that's where we start.
Okay. So with everything that you see and treat on a regular basis, how do you determine when it's time to maybe treat with medicine versus maybe a surgical option?
So a lot of that comes with timing too. So if an infection or infective symptoms persist for several months despite optimal medical therapy, maybe several rounds of antibiotics, then we start thinking that maybe we need to look further into things. And a lot of times that will start with a CT scan of the sinuses to get a look of the anatomy and see if there's blockages or any trapped mucus. Another thing too is if the patient has multiple infections to the tune of 4 or more a year, that's when we start looking more closely with imaging, and then from there we decide, is surgical intervention something that is necessary to try to rectify this problem going forward.
After there is surgical intervention, do you find that, and I guess it depends on what the surgery is, but how much, the recurrence of having to be on so many medicines, et cetera, for the patients, or the recurrence of a sinus infection, does it decrease?
It does, and it should, because what the surgery essentially does is reopen the drainage pathways, allow them to function more appropriately, allows us to get therapies deeper into the nose topically that can help with inflammation, help with washing out, help with antibacterial delivery. So yes, it typically does tend to significantly decrease the amount of oral medications that they have to take.
Great. Well, is there anything that I haven't asked you that you would like our viewers to know about?
Just that we're here to help you with your sinuses if you need.
Thank you so much, Dr. Hardy. I really appreciate your time today and learning more about your field. Don't forget, guys, if you need an ENT or any other doctor, please come see your friends here at Baton Rouge Clinic and support local.